So our recommendations were slightly different from the ESC and the Canadian national guidelines. We feel that we have a different group of patients in Atlantic Canada. These patients are older and sicker, and hence to have a blanket change in treatment we didn't feel was appropriate. There are potential risks with these medications, including an increased risk of bleeding, and particularly with ticagrelor and prasugrel. We felt that we should use these therapies judiciously in certain patient groups, the highest risk groups. We should look at using new therapies, but only on a patient-per-patient basis. There are certain side effects of these medications, and it's very early on in using these medications in various different groups of patients, and we feel that we had to be very cautious in going forward and making sure that we use them in patients that really need them. And our patient population in Atlantic Canada is somewhat different from the groups that were studied in these trials. So we had to be very careful that we don't have a change from what our old therapies were to the new therapies, and that we're able to marry both therapies and treat each patient individually to the best of our ability.